We've been using BTK inhibitors at the National Cancer Institute for years now, and one of the DLBC, or one of the non-Hodgkin lymphoma subtype that's been has most benefited from these agents is mantle cell lymphoma, where there are 3 FDA-approved agents in the United States, although Ibrutinib was just recently withdrawn from the US market. Acalabrutinib and Zanubrutinib are still approved for use, as well as a newer non-covalent BTK inhibitor with Pirtobrutinib, which is approved. These agents are approved in the relapsed refractory setting, and again, are given continuously until disease progression or toxicity. This is a very different approach from that of the ViPOR regimen, which again has been shown to use non-continuous dosing for a fixed duration. When BTK inhibitors are given as monotherapy, they are active and they do induce responses, but they rarely induce deep responses. So complete responses are often in the 20 to 30% range, and not for an extended duration. You know, the median progression-free survival in these patients is usually around 1.5 years, 2 years, with about 50% of patients remaining progression-free at the 2-year point. So far, early data with the ViPOR regimen in 26 patients with mantle cell lymphoma, we showed that all patients, including relapsed refractory and untreated who completed therapy, achieved a complete remission. And it was also very deep in that patients who had detectable or had VDJ clonal rearrangements that were detected for minimal residual disease assessment, 95% of them achieved MRD undetectable status at the end of therapy. And so far, with a median follow-up about 1.5 years, the ViPOR regimen, there's about 88–89% of patients that remain progression-free. So longer follow-up is needed, but it is looking to be very active and more so than BTK monotherapies. So that actually prompted us to collaborate with our European colleagues in the European Mantle Cell Network to propose even a randomized phase 2 study of fixed duration ViPOR of 6 cycles versus BTK monotherapy given indefinitely till progression toxicity, to show more definitively in a randomized phase 2 setting whether fixed duration ViPOR can produce an improved 2-year progression-free survival compared to the standard which is currently BTK monotherapy.